before I introduce myself and I ask you a kind of opening question, is there anybody here from England? Okay, you probably guess what I'm going to say. I'm really sorry about what's going to happen tomorrow. No. Okay. The word is, I think, at least 30 points difference, probably.
Not so sure. I'm in Wales, so I'll shift.
For those of you who are wondering what on earth we're talking about, there's a big rugby match taking place tomorrow. Yeah, it's the annual occasion when Wales beat England at rugby. Okay, so this is me, everybody. My name is Simon. I currently have a number of roles, as you can see. 2 days a week I lecture at the University of Wales Trinity St David, which for those of you who are not familiar with this area is about 60 miles that way, I think. Is that west? Yeah, it's about 60 miles that way. 3 days a week I work for the Aneurin Bevan University Health Board in their weight management service. And that's where I've been this morning, so I do that Wednesday to Friday. Of course, the reason I'm here, I guess, is because I also tutor on the postgraduate diploma and the MSc in obesity and weight management, and I've been doing that for a number of years now, and thoroughly enjoy it. And the last thing I do, which is a kind of voluntary position in my spare time, is I'm chair of the UK Association for the Study of Obesity. So I have to ask, is there anybody here doing the obesity and weight management program? Brilliant. Okay, I think we had one last year. There are more on the course, but I think there was one in attendance last year. So hopefully we will no doubt meet one another online. Can I say that? Yeah, you know what I mean. By way of further introduction, I used to work here at the University of South Wales up until fairly recently, last summer, which is how I became involved with MSc Diploma MSc. Okay, when the course in obesity and weight management was proposed and written, so I was involved in writing the course, and I've been fortunate enough to tutor on it ever since. So I now feel I think I'm kind of fairly well acquainted with the program and the way they run. And I think over the years that I've been tutoring and observing students and chatting with them online about the course. Stop fiddling, is it? Okay. I've learned a lot, I suppose, both in terms of how to facilitate the online discussion and the kind of feedback we get back from students as well, and kind of to figure out what works, what doesn't work so well. So what I plan on doing at the end of the presentation is to give you some of my own kind of personal tips and advice on kind of what I've said is kind of achieving excellence, which I suppose is what everybody hopes to do. Okay, so I need to press a button. Okay, so just over to you for a moment. I wanted to ask you this question, and apologies if my colleagues have asked you this question already today. Why are you doing your chosen course? Would anybody like to tell me? Why are you doing your chosen course? And there's no right or wrong answer to this, of course.
On convenience. I want to gain some confidence because I was away from the medicine 7 years.
Oh, okay. To gain some confidence.
Yeah.
Having taken a break, a career break.
I was in break 7 years. Now I again.
Okay.
I'm trying for registration exam also.
Okay, fantastic. Okay. Anybody else? Reasons for doing?
I suppose ambition, personal development, and trying to be the best I can be in my field.
Okay, good. Ambition, personal, professional development, to be the best that you can be in your field. Anything else? Anybody doing the courses for the same reasons?
I want to try and help improve the field. I don't think we're getting pain management quite right still, and I want to be part of improving that field as well as improving myself and my own understanding.
Ambitious then?
Yeah.
A pioneer in pain management.
Yeah, we don't do it very well.
Okay. Okay. Fine. Good. Anything else? There's one answer in particular I'm kind of searching for.
Enjoyment, specialist
Enjoyment, specialist interest. Fine.
To contribute to that, like to understand my role. Like I'm doing one in medical education, so I would like to know what my role would be in facilitating growth and educating political students.
Okay, great. One more before I move on? Or have we exhausted the list? Of course, there are all kinds of different reasons. Personal reasons, professional reasons. You may wish to become more knowledgeable in the specific subject area and to become a pioneer, a leader. Requirements for CPE, continual professional education and development. In other words, you're told you have to do something. Because you like online learning. Has anybody done any online learning before? Yes? No? Okay. Career progression, I think, has been mentioned, or maybe a career change. What I want to talk to you about, and I think this is an important reason, and that's using high quality evidence. Becoming better, becoming more acquainted, becoming familiar with the academic challenge of using high quality evidence to support decision making, to support evidence-based practice, evidence-based medicine. Okay. So what I propose to do is to just briefly at the beginning look at different types of research and different types of evidence. I'm probably aware of the fact that within the room I may be talking to people who've kind of studied research quite extensively in the past, maybe some epidemiology. You're used to using evidence, and there's nothing at all I'm going to tell you in this presentation which you don't already know. And there might be other people in slightly different positions. So I kind of plan on starting from the beginning, if you like. And I say a lot of this is based on my experience of tutoring. We look at some examples of how to use evidence in written discussion and assignments. Okay. To become aware of some of the potential pitfalls and the bad practice that can creep in if we're not careful, and how to avoid them. And then I said, to finish with some of my own kind of take-home messages, if you like, about what I think is required to achieve excellence. Okay. So we've all become, I guess, very familiar with this idea now of evidence-based practice, evidence-based policy, evidence-based medicine. Everything we need to do, we're told, should be underpinned by evidence. Okay? I'm confronted with this time after time after time after time, especially within my work with the UK Obesity Association. I'm working with colleagues across the United Kingdom and across the European Union. This comes up in conversation on a daily basis, about the need for evidence-based policy, evidence-based action, or the need to develop the evidence base further to tackle obesity at the kind of individual and the population level. Okay. So I guess we're all pretty aware now of the importance of taking an evidence-based approach. But there's evidence and there's evidence, isn't there? Yeah. And I think what I want to talk about a bit, and what I hope to encourage, is a more selective use of evidence to support the work that we do, to support the online discussions that you'll take part in, and to inform your written submissions as well. Okay, it's about being more discriminatory, I think, and more selective with the kind of evidence that we use. So we find evidence in lots and lots of different places. Of course, the kind of evidence that we need to be considering is the evidence which I've underlined at the top of this slide, evidence that appears in scientific publications, in peer-reviewed journals and authoritative reports that come from organisations like the World Health Organization and the National Institute for Health and Care Excellence, and so on and so forth. So very simply, and often when I talk to students at all different levels about research and research design and the need to use evidence, I start by saying, we can very simply, we can categorize research in a number and lots of different ways. To begin with, we might just describe evidence as being, research as being primary or research being secondary, and this is not a kind of an exclusive, extensive list. There are other kinds of research designs, of course, but in terms of observational studies, primary studies, we're looking at things like ecological studies, cross-sectional surveys, case control studies, my favorite kind of prospective cohort studies, large studies often of people living in the real world and being followed up over a long period of time, where we can observe what happens to people when they're exposed to all different kinds of environments and conditions and so forth. Okay. And then we have experimental and quasi-experimental studies, controlled and non-randomized controlled trials, studies that look at the effect or the wide varying effects, if you like, of interventions, some that have randomization, some that don't have randomization. And then, very importantly, I think, of course, and this is being discussed very frequently these days, is the importance of secondary evidence, review level evidence, evidence synthesis and evidence summaries, reviews which are sometimes systematic. Okay, so I'll talk about systematic reviews quite a bit as we move ahead. But the key point that I wanted to get across, if you like, with this slide is that when we're addressing questions, when we're given a question and we have to address it either in a discussion or in writing or in conversation, we should be aware of the type of study and the type and the quality of evidence that we use to support our arguments when we engage in this discussion. Okay. And I think the starting point for that is an appreciation of what type of study is this? Yeah? Is this a primary study? Is this a secondary study? If it's a primary study, is it observational or is it experimental? If it's an observational study, what kind of weaknesses do these observational studies typically have? If it's an experimental study, is it a true experiment, if you like? Have the authors of this study used the gold standard randomized controlled trial? Yeah. And if it is a randomized controlled trial, why have they used a randomized controlled trial? Is it a good randomized controlled trial or not so good randomized controlled trial? And so on and so forth. And of course we do that whilst accepting that in some instances it's not possible to conduct a randomized controlled trial. Okay? So we have to rely on perhaps evidence of a slightly lower quality, which has inherent weaknesses. Yeah? So it's really just about starting from a position of accepting and realizing that it's incumbent upon us to use evidence in the online discussion and in our written work and so on and so forth, but to be aware of the evidence that we're using. Okay? Not to use the first piece of evidence that we find, but to be aware of the type of study, the weaknesses and the strengths within this study, and the type of evidence that we're using to support our answer. Is that okay? Does that kind of make sense? We can categorize primary research in a number of different ways. Again, a very simple way of categorizing it is to kind of describe it as descriptive research, descriptive observational research. I've used an example here of physical activity in the context of type 2 diabetes, something that I'm interested in and know a little bit about, so I'm not going to kind of wander into areas where I feel uncomfortable. So, I'm used to looking at studies which are descriptive observational studies, describing evidence that shows that people who are inactive have a higher risk of type 2 diabetes. Okay? But I know if I'm looking at a survey, or I'm looking at a simple descriptive observational study that shows that people who are inactive, who don't meet physical activity guidelines, if you like, have a higher risk of type 2 diabetes, that research has limitations, it has weaknesses. Okay? It's not telling me anything at all about the effect of physical activity necessarily. Okay? It's a starting point. Okay? It's a starting point in the discussion. It's a starting point in the journey of getting a comprehensive picture, if you like, of the relationship between physical activity and type 2 diabetes. We might look at an observational cohort study, okay, which addresses the question of how much physical activity is required to change diabetes risk. By studying, a large group of people over a fairly extensive period of time, if people do different levels of physical activity and they have different levels of diabetes risk, we can begin to quantify and ascertain, the nature of the relationship between physical activity and diabetes. And of course, this goes the same for lots of other contexts as well, not just physical activity and diabetes. It's the kind of idea behind the research design and their strengths and weaknesses that I think is the important point. Then we can move on to kind of doing experimental work, back to the randomized controlled trial, if you like. What happens if we purposefully or intervene to change the amount of physical activity that people do? Yeah. Exactly the same kind of scenario in a drug trial, really. Yeah, where you kind of purposely intervene with a particular drug to change it, to try and change an outcome. Okay? And then finally, what I've described here is explaining research. Why, if we can show in a randomized controlled trial that physical activity changes the risk of diabetes, I suppose the question then is why? What's taking place? What's the mechanism? How is this happening? Okay, so different types of studies, different situations, all important. Okay, each different study has its kind of strengths and weaknesses. And I say the point that I just want to get across is about using these studies, recognizing the study design and using them correctly to support the arguments that we put forward. Okay. Taking our time to think about the evidence that we're using, rather than jumping in straight away and almost using the first piece of research that we can find that looks relevant. How many people use systematic reviews in their work and read systematic reviews on a regular basis?
Read them on a regular basis. They determine what I do, but they're not something I read a lot of.
Okay, and the field of work you are in is?
Practice.
In general practice. Okay, so we're told more and more these days, we seem to be told more and more these days that, we require systematic review level evidence whenever possible to kind of enact decisions sometimes. I find myself, I often encourage students, and I say, whenever I'm confronted with a question and perhaps I don't know the evidence very well, the first place I usually look is there a systematic review? Is there an up-to-date, high-quality systematic review that I can read to get a good idea of the evidence in this particular field? Okay. So systematic reviews, with and without meta-analysis, are important. I don't know what the exact figures are. I've looked these up on the odd occasion. How many people would struggle to keep kind of up to date with the literature in their particular field. Yeah, it's, you know, every day I kind of almost feel like I'm having a bit of a crisis, if you like, a meltdown. You're like, you know, why didn't I know this? Why didn't I read this study? You know, and I didn't even know this journal existed, yet alone kind of read the papers in there. So we know that this is a problem, and therefore, of course, systematic reviews have become extremely important to help us to combat, to manage the sheer volume of studies, of evidence that we're confronted with. But I think we've now arrived at a situation where we're struggling to cope with and manage the number of systematic reviews that are being published. You know, as I say, I'm not sure what the exact figures are, but they have been published. You know, we're talking about hundreds of systematic reviews, new systematic reviews being published all the time. Okay? And I think it's almost like every PhD student who starts a PhD, the first thing you do is do a systematic review and publish it, you know. So how do we manage to control, how do we cope with the sheer volume, the number now of systematic reviews that are being produced? Any thoughts? We can do a systematic review of systematic reviews. We can. And there are guidelines. There are guidelines available for conducting systematic reviews of systematic reviews. I'll give you an example. One of the hot topics in the area where I work, and I'm sure a lot of you may be familiar with this topic because it seems to go beyond the subject area where I work, is around diets and health, and particularly low carbohydrate diets and health. Seems to be in the news on a fairly frequent basis. So there's been a fairly recently published systematic review of systematic reviews looking at the effect of low carbohydrate diets. Yeah? And these pieces of work try and kind of critically appraise the systematic reviews that have been produced. So just recently in the obesity and weight management group of students, I've supervised a couple of their MSc dissertations just recently, and a couple of them, 3 of them in fact, have completed systematic reviews of systematic reviews. One of the things I'll try and do throughout the presentation, it might be helpful, I think at the start of the course rather than towards the end of the course, is to signpost you to some useful resources. So is anybody familiar with the Equator Network and the website for the Equator Network? No? So good, I've achieved something, at least one thing today that's useful. The Equator Network was established, I'm not sure exactly when, but it's a very, very useful resource of a resource of resources, if you like, that provide lots and lots of information about different types of research designs, critical appraisal tools, and so on and so forth. So something that's certainly worthwhile visiting and becoming familiar with. What about our friend the hierarchy of evidence? Are you familiar with the hierarchy of evidence? Yeah. So the hierarchy of evidence, and this is a pyramid which was published in the journal Circulation a number of years ago in a paper which asked the question, you know, is there a rigid hierarchy? Yeah, with case series and opinions at the bottom of the hierarchy of evidence, gradually moving up the pyramid through cross-sectional studies, case control studies, retrospective cohort studies, prospective cohort studies, and at the very top, of course, the randomized controlled trial. Yeah. So I think, as I say, to come back to the point of this talk, I suppose, it's about recognizing when we're using evidence, when we're citing research papers, where do those papers sit in the hierarchy of evidence? Yeah. And is it the best available evidence that we can use to support our answer? Yeah. you know, if there's a discussion point or a question which is specifically about the effectiveness of an intervention, whether it be a surgical intervention, a medical device, a drug, physical activity, a diet, whatever it might be, if the question is directly about evidence for effectiveness of a treatment, then hopefully we're focusing towards the top of the hierarchy of evidence, and we're switching on and we're immediately looking for evidence from randomized controlled trials or systematic reviews of randomized controlled trials. Yeah? Is kind of one of the simple points I wanted to get across. Okay. That particular pyramid, of course, ended at the top with randomized controlled trials. Others go beyond that. This is the levels of evidence, the hierarchy of evidence from NICE, and according to their grading system, 1 star, the highest level of evidence is from high quality meta-analyses, systematic reviews of randomized controlled trials, or individual randomized controlled trials with a very low risk of bias. Very low risk of bias. Which I guess is a very important point in terms of, you know, being able to critically appraise research and decide on the quality of the evidence, the quality of the research that we're using. It's about looking for bias within the research, and of course bias within research comes in all shapes, sizes and forms. Okay. But there are tools there to help us. Okay. And we don't have to be instantly, you know, world experts in critical review and identifying bias in research, but it's about, I think, starting somewhere and attempting, when we look at research, not just and research papers, not just to accept it, not just to read the introduction and the conclusion in the abstract and accept it, but about, you know, engaging with the research, reading the methodology in some detail, looking for areas where bias exists, which I completely appreciate, and everybody will agree with me, I'm sure, is not an easy thing to do. Yeah, but I think it's something that, you know, we're obviously keen to encourage. Yeah, people demonstrating that willingness to attempt some critical appraisal, to describe the findings of a research paper that you're using to support your answer, whilst at the same time, perhaps in the discussion, trying to identify or highlighting some of the weaknesses, okay? Some of the forms of bias that exist. So, a typical question, it's not an actual question, but I've simplified it. A typical question that I might ask on Module 2 on the Diploma for Obesity and Weight Management, which is about the epidemiology of obesity and the health risks of obesity, I might start by asking the group, you know, please discuss the association between obesity and mortality. So, what evidence am I going to use? What evidence am I going to use to support my discussion? When I write something, I think Carl probably this morning was talking about the online discussion forum, which of course is the kind of the daily, almost daily interaction that tutors and students have. You know, this is of course a very important part of the learning experience. So this is the question I've been given. What evidence am I going to use to inform the comments I make in this discussion? The Daily Express, of course. You know, why not? Only one thing worse than the Daily Express, Daily Mail. So here's the Daily Express reporting on, not mortality, but clearly something linked to mortality, obesity is apparently linked to 11 cancers. And of course, if the Daily Express is telling us, then it must be right. Okay? So, definitely not. Okay? Definitely not. And I know none of you would do that. Okay? Reference the Daily Express and an article in the Daily Express in response to the question. Okay? And not just the Daily Express, but you know, other sources like it. I do see it, not amongst students like yourselves, but I have experience. I do see it. This I see quite a lot. Again, maybe not so much with students like yourselves, but another course is the NHS website. Yeah, of course, anything to do with health. This is where I'm going to go for my information. Okay, and I say to people, you know, this is a fabulous resource, a wonderful resource, but it's probably not what we should be looking at as a form of evidence to support the discussion that we're going to have. Okay, even if it's referenced NHS, I sometimes see people saying, you know, the NHS has conducted research which shows that. And I kind of suggest, well, you know, I'm not sure the NHS has conducted this research, or is it people perhaps who are employed within the NHS who've conducted it? So actually, shouldn't we give them the credit by going to the primary source of evidence and referencing those people? Yeah, absolutely. So certainly better than Daily Express, but hopefully, you know, we can do better. Now this looks promising. We have a peer-reviewed article, paper, published in the European Heart Journal 22 years ago in 1997. And for some reason, the author chose to pick a rather strange way of describing obesity. Body habitus, and it's a reference to methods of body habitus assessment. It's looking at obesity amongst other methods of looking at physique in relation to heart disease in men. Okay. So it looks promising. It's peer reviewed, it's in a high quality scientific journal, European Heart Journal. Okay. So, should we use this? It's a bit out of date. It's 1997, so I think absolutely we probably can do better. Yeah. I would say, it's European. The research within it goes beyond European borders. I can tell you that with 100% certainty. All kinds of studies, case control studies, some cohort studies, some studies that used coronary angiography, some studies that used other techniques, a real mishmash and a mix of studies. I can also tell you that with 100% certainty. Because I wrote it. and it's not very good. Okay, I'm honest enough to stand here and admit that it's not very good. Okay, I wrote this when I was a PhD student, and I wrote it under a fair amount of pressure from some of my supervisors, who of course said, "You're a PhD student. The first thing you have to do is write a literature review." And when I didn't do it in the time frame that they wanted me to do it in, I was under more pressure to finish it, so it was like, oh, crikey, right, send it off. And I'm very grateful to the peer reviewers who gave it a favourable review and said, with some minor alterations, we'll publish this. Happy days. If you were to critically appraise it, I hope that you would come to the conclusion that it's not very good. I know there are all kinds of weaknesses in this study, in this particular paper. Okay, all kinds of weaknesses. As one of the peer reviewers actually said to me when I met him on a train once, completely coincidentally, if nothing else, it's a good source of references. Anyway. Okay. So the message I suppose I'm giving you is, we need to be careful. Just because something is published and it's in a good quality journal doesn't mean it's high quality. Okay? There's no substitute for critically reading either the primary research or indeed critically reviewing secondary research like this. This looks very relevant for sure. The impact of body mass index and the metabolic syndrome on the risk of cardiovascular disease and death in middle-aged men. So it's directly addressing the question that we're discussing. Please discuss the relationship between obesity and mortality. We have a measure of obesity, body mass index. We're looking at cardiovascular disease and death. So there's a measure of mortality. Okay. It's published in Circulation, again, exceptionally good journal, a bit more up to date, 2010. Okay. So certainly relevant, but it's very specific. Okay. It's a US study looking at middle-aged men. So I'm not saying discount it and don't use it. I'm just saying recognize the boundaries, recognize the limitations. Okay. It could be part of an answer, part of a discussion, but it's not the entire discussion. With a little bit of care and a bit of time, we can search the literature. We have great resources at our fingertips, literally on our keyboards, where we can search various search engines, various databases, using filters and try and locate the kind of research, the kind of evidence that we need to be using to give the best possible arguments and discussion that we can provide. Okay. So now we have a systematic review with a meta-analysis of 230 cohort studies looking at 3.74 million deaths amongst nearly 30.5 million participants. Published in a British Medical Journal 2016. So it's up to date. It's broad ranging. It has it's encapsulating 230 studies. Yeah. So we're at the top of the hierarchy of evidence. And very importantly, what we have, of course, in this study, which I certainly didn't include in my literature review, are clear and transparent methods. The authors have written about, what they've done, the process that they've been through to complete this research. They tell us about their search strategy and their inclusion criteria, about the studies that were selected and the studies which weren't selected, so we know what's in and what's out. They've told us about data extraction, what data they've extracted from these papers, and their statistical methods. Yeah. So it takes a lot more time and it's a lot more difficult, but the reason, of course, that we have these clear and transparent methods is so that we can critically appraise, so that we can attempt to determine whether or not we agree with the conclusion of the paper. Yeah? Whether we agree with the conclusion of the paper. That's good. So we've gone from, the Daily Express, definitely don't use, through different levels of evidence, up to, I'm suggesting, perhaps where we should be starting. Okay, where we should be starting, and we can simply describe and report what this paper is reporting. Yeah, we can regurgitate, or we can regurgitate and describe with some attempted critical analysis, trying to address and look at some of the weaknesses and limitations, even within studies like this. Thankfully nowadays, one of the things I'm working on with colleagues in the health board at the moment is some projects around evaluating weight management services. Of course, you know, it's incumbent upon us as health professionals, as researchers, clinicians, and the like, you know, to talk about, to write, to disseminate about the work that we do, especially when we have interventions, yeah, to be able to tell the world what we're doing and what results we've got. You know, we're told, you know, if we don't do this, frankly, you know, we're performing slightly unethically because we're utilizing resources to deliver interventions, we're getting results, but we're not disseminating. So dissemination, of course, is very, very important. And there are, you know, there are lots of tools available to us nowadays, guidelines available for researchers to try and improve the clarity and the transparency with which research is disseminated, with which it's written up. Yeah. So there are guidelines for researchers who conduct randomized controlled trials which say, this is what you need to include in your methodology. For people to be able to critically analyze your work, for it to be incorporated into systematic reviews, we need to know exactly what it is you're doing or have done. Yeah? So one way, and that's really helpful, not just, I think, for people who are writing up their research. As users of research, we can use those tools to check, you know, have they followed the guidelines? Have they included everything that we're asking them to include? Yeah. For randomized controlled trials, for non-randomized controlled trials, for case control studies, for cohort studies, for systematic reviews. On the Equator Network, I think you'll find all of these tools available. Guidelines for authors saying, if you're when you're writing up your research, follow these guidelines, because it makes it better for everybody when it comes to being able to critically analyze, synthesize, and summarize research. Okay? But I say the nice thing is we can use those to kind of to check to see what people have written about. And I thought, you know, I mentioned this a moment ago. We also now have guidelines on how to do a systematic review of systematic reviews. The AMSTAR method, in fact, this is a slightly old version of AMSTAR. There's now AMSTAR 2, which is a new and improved method of AMSTAR. Okay. So we can, again, we can use this, even when we're using systematic reviews, we can use this if we have the time. And I appreciate finding time is very difficult sometimes. So I'm not for 1 minute suggesting that, you know, every time you read a systematic review, use AMSTAR 2 and kind of do it. You know, sometimes we have to work more quickly, we have to work rapidly. But if you do have time, these tools are available, and, you know, I think sometimes it's better to spend some time critically analysing one paper thoroughly than trying to skim across lots of papers superficially. Just to go back to the hierarchy of evidence momentarily, the message I guess I would give to you and others would give to you is, you know, don't take the hierarchy of evidence too literally. I think there are examples of this being played out, you know, very often, where people take the hierarchy of evidence too literally. They say, oh, you know, we shouldn't be promoting this, we shouldn't be advocating this, we shouldn't be doing this because there's no evidence from randomized controlled trials. I mean, clearly in the area where I work, you know, in obesity prevention, the UK government, as I'm sure you're all aware, and other governments around the world have taken that decision, a policy decision, to introduce a tax, a levy on sugar-sweetened beverages in particular. Okay, can we do a randomized controlled trial to look at the effectiveness of the sugar levy? Theoretically, possibly, practically not. So, you know, a decision is made, a policy is enacted without evidence from a randomized controlled trial, but based on, you know, the best evidence that we have, and by building a consensus. Okay? So I say, don't take it too literally. Don't be too dismissive if there aren't RCTs, but if there are, and if these RCTs have been systematically reviewed, and if the systematic reviews are of high quality, then, you know, we're using the best available evidence. Ask yourself the question, you know, what am I being asked? What's the question? What am I being asked? What's the strongest evidence that I can find and use to support my arguments? All okay so far? Yeah? Nothing too concerning or worrying or problematic? Yeah?
Can I just ask where things like nice guidelines sit in your hierarchy levels? Say you're sort of a systematic review that has then produced a guideline which you assume has taken into account the best available evidence.
Yeah.
Can you use that without going back to the source of where they got that evidence from?
I guess so, yeah, because I mean, if you're quoting nice guidance, but I think it would be good to be familiar with the evidence base and the systematic reviews that have been written and perhaps commissioned to inform those nice guidelines. Yeah. I just thought we'd kind of do a bit of a Q&A bit for a moment. Yeah.
Sorry, I was going to say, so on your last point you said about the randomised controlled trial, and it's best to have a randomised controlled trial that's been systematically reviewed. Would you then say it's best to then use one that's been reviewed again, so you keep going back to that? Is that what you're saying? Sorry.
Yeah. So high quality systematic review of high quality randomized controlled trials, you know, I would suggest, and others would suggest, that, you know, this is the kind of top of the hierarchy of evidence. This is the best available evidence that we have. So is your question then about, do we need to have a systematic review of the systematic reviews?
Yeah, and then would you research the randomised controlled trial and then look to see if it's been reviewed? How would you do that? You just look it up and to see if it's been in a systematic review? Sorry.
No, it's fine, it's fine. So you're asking me, so if you have a randomized controlled trial.
How do you double check that that's been systematically reviewed?
Okay, so you look in the references of the systematic review, and you can see whether or not it's been included or not. Of course, there's something, I mean, that's one of the key things that we have to consider if we're critically reviewing a systematic review, is to look at the inclusion and exclusion criteria. You know? Because one way, of course, of influencing the outcomes of a systematic review is by influencing the studies that are being reviewed. Yeah, we can introduce bias by having, through the inclusion and exclusion criteria. Yeah. What evidence would you use to support your answer? So if we're sitting in a discussion forum, and somebody asked the question, you know, please discuss the effectiveness of liraglutide for the treatment of obesity. What evidence would you use to support your answer? And also the second part to that, which takes a bit more thought, I suppose, is what information would you include in your discussion? You know, in your discussion. I'm trying to put myself now in your position where you've had a busy day in work, or you might even be in work and you're taking a kind of short break in the morning or lunchtime, or you're working a night shift and you've got a spare moment, or you're doing this on the weekend when things are a bit more relaxed, and the tutor set a question, you know, and there's something to do in this case, you know, about the effectiveness of liraglutide. So you have to put something on the discussion forum. What evidence are you going to use? Or what are you thinking about putting in your discussion? You could answer this question, you know, how effective is liraglutide for the treatment of obesity? I've used this systematic review, it's effective. That's it. I'm off. I'm finished. But that's not a discussion. So what would you think about? And this is not, you know, what I'm going to put up when I show you that my answer, if you like, is a suggestion. You might say, well, I wouldn't include that, or I would include something else.
Include something about the pharmacology of it and how it's potential interaction maybe? In that, has it potentially got an ability to affect appetite?
Yeah. I think if you were writing perhaps a more extended piece, this is my opinion, I think if you were writing a more extended piece about the effectiveness of liraglutide and the mechanism of action, how it works, then absolutely. But I think in this case, it's more about is liraglutide effective on its primary outcome, if you like, which is obesity or weight loss.
I will look at studies. I will look at studies that have written evidence-based studies on if liraglutide actually causes weight loss, because with obesity I'm looking at weight loss, and compare the studies, how many people actually lost weight.
Just let me stop you for a moment. So you'd use studies, great. Which studies would you use? What type of studies would you use?
I will go for randomized controlled.
Yeah. I think, you know, it's hopefully everybody would come to that same conclusion. I think here it's fairly straightforward. The question is direct. It's a closed question. It's direct. How effective is liraglutide? Well, the evidence for this is going to come from randomized double-blind placebo-controlled trials. Okay, so if they exist, if they've been conducted, then let's use them to inform our answer. Okay, and if there are a number of these trials and they've been systematically reviewed, let's use that. Okay, let's use that. And I'm talking now about, you know, the perhaps, you know, the outstanding, you know, perfect answer to the question in a discussion forum, which of course is not always achievable working within the constraints that we have to work in. But in the best case scenario, you know, we're looking to answer this question by referring to a systematic review of randomized controlled trials, and then we can maybe engage in a bit of critical analysis of the systematic review. Is it a good one? Has it been reviewed by others? Yeah. And then maybe dipping into the systematic review to actually look at some of the individual trials. Okay. What information might you think about? What information might you include? Because the question is about effectiveness. So what information might you include in your discussion, in your answer? It's okay. I've got two people speaking at once in the moment. Go on.
Outcome of the patient who are using the liraglutide.
Okay, so the outcome for patients who've been randomized to liraglutide, outcomes in terms of weight loss, because that's the kind of primary outcome, if you like. Has this drug had an effect on weight loss? If so, how much weight has been lost in the liraglutide arm of the trial? Yeah. In comparison to any weight change in the placebo, in the control arm? Secondary outcomes? Side effects, absolutely. Side effects, adverse events. Compliance. As I said, these are my thoughts, you know, on if I was answering that question and I had sufficient time to be able to do it, what I would try and get into my discussion, because it's about directly addressing the question. Okay, it's about directly addressing the question. The question isn't what is liraglutide, how does liraglutide work? It's how effective is it? Okay, so use randomized controlled trials, systematic reviews of RCTs as we've agreed. Those trials which are most up to date. Things then related to the patients. their age, their sex, their ethnicity, their degree of obesity, whether the group had comorbidity, and what type of comorbidity, the number of people who are actually treated, the number of people in the control group. I think, as you rightly point out, how many people in each arm of the trial dropped out. Yeah. Something about, some statistical information about about any changes. What was the kind of mean change in weight, the mean change in body mass index, secondary outcomes, mean change in blood pressure and lipids, mean change in glucose and insulin and whatever else the investigators might have measured. Also, very, very importantly, the precision of these estimates. The reality is, some people quite like statistics and will include statistics in their answers, and other people will not like statistics so much, okay, and are a bit put off and a bit frightened by statistics. Of course, it's a good idea to have, a basic understanding of some of the most important concepts in statistics. So, understanding, a mean, for example, and a mean change, but also something around the precision of those estimates. So these are typically reported as the 95% confidence intervals, or as the 95% confidence interval. So this is saying, if we were to repeat this study 100 times, 95 times out of 100, we would get a change in between these two limits, the lower limit and the upper limit, which of course is very important. Okay. The NNT, the number needed to treat, I guess an important measure of effectiveness. As somebody rightly said, unintended consequences, side effects, adverse events, isn't all this to do, and many of you will be clinicians, isn't all this to do with evaluating the effectiveness of the intervention, in this case the drug? And then hopefully, of course, some strengths and weaknesses and a conclusion. Yeah.
Could you not expand on that as well? When you say effective, a randomised controlled trial between liraglutide and a placebo does not mean that liraglutide may come out brilliant compared to the placebo, but it may not be as cost effective or as come out as well against, sending everyone to the gym 3 times a week, taking away the chocolate. Yeah. So, how do you define effective in that, in terms of, it does what it says on the tin and loses weight, but that doesn't mean it's the most cost-effective or sensible thing to do in terms of a large cohort of patients.
Okay, so I think I would address your question by simply saying, if you wanted in your answer to talk about cost effectiveness as well, absolutely fine. I think that's going one step further again, and that would be, for me in a discussion forum, that would be a huge plus, because you've gone beyond talking about effectiveness to talk about cost effectiveness as well, which of course is extremely important. Yeah. I'll talk about this later on, but the other thing, of course, which is extremely important, and I think it's something which, of course, we need to get right from the beginning in NGSB and keep getting it right in every post, in every piece of work, and that's referencing our work. Yeah, referencing our work. I think somebody probably spoke to you this morning about referencing. Yeah, covered that. So we're not going to go into that any further. My advice would just be, be familiar with the referencing guidelines and follow them to the letter on every occasion. Okay, reference your work accurately, reference your work consistently.
Can I ask one question? If we get reference from 6 or 7 sources, so do we need to include all this or only 2 or 3 is okay?
You should reference everything you use. If you're using your work to support your discussion, to support your writing, then you should acknowledge it and reference it, yeah. Which is one of the nice things, of course, about using systematic reviews, because then you kind of, you've got one reference, but it's representing maybe, 25 RCTs, yeah. But I think if I was using that one reference, I would make that very clear in my discussion, yeah. The evidence that I'm using is from a systematic review, which includes 25 randomized controlled trials, yeah. Similar or same question, same two questions at the top, I should say, different question in the middle. What is the risk of type 2 diabetes in people who have obesity? Yeah.
I didn't really quite get your last statement about randomized control trials and systematic reviews.
Okay, so you may not have heard the question. So the question was about if you use more than one study or two studies, you use 7 studies, for example.
7, 8, 9, 10,
Yeah, should they all be referenced? So the answer to that question was clearly yes. And I was just making the point that if you use, one of the advantages of using a systematic review is that you're using one source. As long as you're confident it's of high quality, because I guess we can go into the literature and find examples of systematic reviews that have come to certain conclusions, and they've later been found to be incorrect. Yeah. So if you're using a systematic review, as long as we're confident that it's of high quality and we believe the findings, and the conclusion is a valid conclusion, then you're using one reference, but that one reference is representing all of the studies that have been reviewed. Yeah. What is the risk of type 2 diabetes in people who have obesity? What evidence would you use to support your answer? What information would you include?
Again, we'll go for randomized control trials that have talked about maybe, I'll look at the comorbidities of type 2, the comorbidities of the comorbidities of what obesity does to diabetes, for example. Yes, I'll look at those randomized control trials. Yeah,
I would just ask you a question. Can we answer this question with an RCT? So if we can, then fine, we look and see if there's RCTs there. If we think it's unlikely or practically impossible that this question could have been addressed with an RCT, then maybe we're looking at the next best type of evidence.
Quantitative studies.
Perhaps prospective cohort studies, systematic reviews of prospective cohort studies which are designed to directly, in a way, do what this question is asking, to address the risk of a particular outcome in relation to a particular exposure. Here we have obesity as an exposure, type 2 diabetes as an outcome, and it's asking the question about risk.
Would you not have systematic reviews of those studies as well?
You can do, and again, I would say, utilize those as much as you can, yeah, with the caveat that you attempt some critical appraisal of the systematic reviews, so that you don't end up reading kind of reviews like the one I wrote. Be confident that they're high quality. What information would you include? I would probably include, as we've agreed, prospective cohort studies, or systematic reviews of prospective cohort studies. Of course, one of the things we have to consider is not just the quality of these studies, but their generalizability as well. If we have a prospective cohort study of white middle-aged men in the United Kingdom, how generalizable is this to other populations in other parts of the world? You might feel that it's very generalizable, and I think you'd need to say why, or you might decide that it's not very generalizable, and therefore look for other studies in different populations as well. Again, try and be contemporary, up to date. We need to think about describing the patients, or not the patients in this case, the cohort, the population being studied, their age, their sex, ethnicity, the frequency and the degree of obesity, existence of comorbidity, the number of participants that we describe as being exposed or not exposed in the cohort study, the number who are followed up. A key thing, of course, in cohort studies is what we call lost to follow-up. How many people are lost in the study that we don't get outcomes on? The average length of follow-up. Has there been any control in the study for confounding variables? Of course, we're aware that cohort studies can be, badly affected by confounding, and researchers doing cohort studies will attempt to control confounding in a number of different ways. Yeah. So, what evidence is there in this study of confounding, and what about attempts to control confounding? We can usually see that by looking at things. The effect estimates in these studies are generally either odds ratios, relative risks, or hazard ratios. Yeah. They tell us about the effect, if you like, the level of risk, and where we have adjusted odds ratios, adjusted relative risks, adjusted hazard ratios, clearly there's an attempt being made to control confounding. We've talked about the precision of the estimates before, strengths and weaknesses, referencing. So I hope I'm not kind of putting people off in any way. I say this is my interpretation of kind of the perfect answer, yeah, to this particular question.
Can I just ask a question? Can I ask what the HR is for?
HR stands for hazard ratio. Yeah, hazard ratio. Yeah. Last one, which perhaps for the purposes of time we'll go over a little bit more quickly. How accurate is fasting plasma glucose for identifying individuals with elevated HbA1c? I would imagine there are probably some people here doing the MSc in diabetes, endocrinology. So I guess a very relevant question there, or maybe you have an answer to this, which is firmly established already. I don't know. So what might we look at to address this question? Screening studies that have looked at the relationship between fasting plasma glucose and HbA1c levels, systematic reviews of screening studies, type of information that might be included. Again, I think it's always important to report upon the population, either the patient or the participant characteristics. Who are the people in this study? Tell us something about them, about their demographic profile, their age, their sex, their ethnicity, and so on. And then the typical measures that are used in these kinds of studies, the sensitivity and specificity, the accuracy, if you like, with which we can identify, in this case, people with elevated HbA1c from simple fasting plasma glucose measurements. So that's my last slide like this, but my take-home message was simply about, look at the question. Look at the question, and before you put pen to paper or fingertip to keyboard, look at the question, think about it, gather your thoughts, and then say, right, okay, what needs to be in this question, in my answer? What points do I need to raise in my discussion, and what kind of evidence do I need to support it with? we've been going for hour and 15, something like that. Should we take a 10-minute stand-in break? No? 5-minute stand-in break.